This diagram explains about the hormone oxytocin. When a baby suckles, sensory impulses go from the nipple to the brain. In response, the pituitary gland at the base of the brain secretes the hormone oxytocin. Oxytocin goes in the blood to the breast and makes the muscle cells around the alveoli contract. This makes the milk, which is collected in the alveoli, flow along the ducts to the larger ducts beneath the areola. Here the milk is stored temporarily during the feed. This is the oxytocin reflex, the milk ejection reflex, or the letdown reflex. Oxytocin is produced more quickly than prolactin. It makes the milk in the breast flow for this feed. Oxytocin can start working before a baby suckles, when a mother learns to expect a feed. If the oxytocin reflex does not work well, the baby may have difficulty in getting the milk. It may seem as if the breasts have stopped producing milk. However, the breasts are producing milk, but it is not flowing out. Another important point about oxytocin is that it makes a mother's uterus contract after delivery. This helps to reduce bleeding, but it sometimes causes uterine pain and a rush of blood during a feed for the first few days. The pains can be quite strong. This diagram shows how the oxytocin reflex is easily affected by a mother's thoughts and feelings. Good feelings, for example, feeling pleased with her baby, or thinking lovingly of them and feeling confident that her milk is the best for them, can help the oxytocin reflex to work and her milk to flow. Sensations such as touching or seeing her baby or hearing them cry can also help the reflex. But bad feelings, such as pain or doubt that she has enough milk, can hinder the reflex and stop her milk from flowing. Fortunately, this effect is usually temporary. Why is it important to understand the oxytocin reflex to inform the way mothers and babies are kept together after delivery? A mother needs to have her baby near her all the time so that she can see, touch, and respond to them. If a mother is separated from her baby between feeds, her oxytocin reflex may not work so easily. It is important for mothers to feel good and confident. So what are the signs and sensations of an active oxytocin reflex? You may notice a squeezing or tingling sensation in your breasts just before you feed your baby or during a feed, milk flowing from your breasts when you think of your baby or hear them crying, milk dripping from your other breast when your baby is suckling, milk flowing from your breasts in fine streams if your baby comes off the breast during a feed, pain from uterine contractions, sometimes with a rush of blood during feeds in the first week, slow, deep sucks and swallowing by the baby which show that breast milk is flowing into their mouth,